Good morning, everyone, and welcome to the All-Ireland Obesity Action Forum event here in Belfast today. I am delighted to welcome you here. I am delighted to welcome our colleagues joining us on Zoom. My name is Joana da Silva. I am the Chief Specialist in Nutrition with Safe Food, and I will be chairing the event today. We have a great lineup of speakers, and I am looking forward to hearing from all of them, as I'm sure you are. Before we begin, some housekeeping rules. So questions are welcome at the end of every presentation if time allows, and if not, we will have a Q&A session at the very end. If you are joining us online, please use the Q&A chat function box at the bottom of your Zoom screen. And for those joining in person today, please raise your hand and one of my colleagues will approach you with a mic. If you have any technical issues when joining on Zoom, please use the chat box function to ask for support, and one of my colleagues will be able to address that. If you are tweeting today about the event, and we do encourage you to do so, please use the hashtag #ObesityForum. And finally, please note that the recording of this session and the presentations will be made available to you all, and we will email you all the details within 2 weeks of the event. I will now hand over to Dr. Aileen McGloin, and Aileen is the Director of Nutrition at Safe Food, and will provide some opening remarks today.
Good morning, everybody. I'd like to echo Joanna's welcome. It's an absolute privilege to be opening this session this morning. We have some fantastic speakers with backgrounds ranging from policy to research, and I'm really looking forward to hearing everything that they have to say. We in this room all know that obesity is a complex disease with multifactorial origins. It's an interaction between our own physiology, the individual behaviors that we carry out, which in turn are shaped by the environment in which we live. And everything that we eat is influenced by our food environment. At the moment, our food environment can be described as obesogenic. And for the past decades, food policies have been focused on making steps to try to improve this in order to make it more conducive to healthy eating and to active living. There are a number of ways that this has been achieved or can be achieved. One is legislation, for example, the sugar tax. There can be guidelines and practical support, for example, for people who are working to improve the built environment. There has been engagement with the food industry to improve the food supply, and codes of conduct, for example, in relation to the marketing of food. And I just want to pick out a couple of exemplars today to, I suppose, highlight some of the good work that has been going on in this area. The first one is the incredible work that's been going on in terms of nutrition standards. So we now have nutrition standards in social and healthcare settings, in schools, in preschools, and even during the pandemic for the food parcels that were distributed. We didn't have any of that 10 years ago, so that's definitely a good news story. I'd like to highlight the work of the FSAI and from our colleagues here in the room from the FSA, and all of the work that's been done on reformulation. And that's through the Making Food Better programme in Northern Ireland and the Food Reformulation Roadmap in Ireland. And there we're trying to influence the amount of saturated fat, sugar and salt and calories in food, particularly that consumed by children. So again, by default, we're living in a better food environment. And the last piece that I just want to highlight is the work that's going on whole systems approaches in Northern Ireland, led by the Public Health Agency. So now we're beginning to have pilot sites throughout Northern Ireland working with councils so that we can take a local approach to improving people's lives and protecting their health. We've been on our own journey in safe food as well. So over the last 25 years, we've been working to build the evidence base in relation to obesity policies. And of course, we've been responsible for developing our obesity prevention campaigns along with our partners. To date, we've very much emphasized individual behaviors. But what I wanted to share with you this morning is that we're moving now to a new approach where we're going to have a public health awareness raising campaign around the food environment starting from early next year. So watch that space. So while I have highlighted lots of good news stories, the Food Epi report, the Healthy Food Environment Policy Index report in Ireland highlighted that we have more work to do. So we're lagging behind in relation to advertising of unhealthy foods, in relation to zoning, like the no-fry zones, in relation to front-of-pack labelling, menu labelling, and in relation to the food that we're providing in workplaces. So there is lots more work to do. And on that note, I'm really looking forward to hearing about the many opportunities we now have and the different examples that our speakers are going to tell us about later today. So on that, I'm going to hand you back to Joanna to introduce our first speaker.
Thank you. Good morning to everybody in the room and good morning to those that are joining us online. The slides coming up, or do I press it? Oh, there we go. Lovely. And thank you for the warm welcome. And it is so lovely to be in this beautiful city on a gorgeous sunny morning. It was raining yesterday, but it's lovely to be here in person. Thank you, Aileen, for doing an introduction to the food environment, so I can kind of save time and skip over that bit. But Sinead and I were talking this morning about the fact that the food environment is everywhere. It's basically any opportunity to obtain food. So it can include physical, sociocultural, economic, policy, and these operate at multiple levels. So from a micro level right through to macro fiscal levels. So there's quite a range of food environments. And again, just emphasising, they are just everywhere. And I'm really intrigued to see what the campaign is going to be starting in the new year. And as we know, food environments influence obesity. Obesity is complex. Obesity is multifactorial. Food environments and what we eat are one part of that complexity. They are not the one silver bullet. This is the very, very old but still very good Foresight systems map, at the centre of which we have energy balance. And you can see that food consumption, food production, as well as the societal influences are all part of that complex picture of why we are interested in energy balance and in promoting good food environments. If we start to think about obesity and the environment, I'm sorry I don't have the equivalent of this for the island of Ireland, but if we look at England, and again, this is older data, we don't have this updated, this is from 2017, we can see that there is a relationship between the density of fast food outlets and deprivation. So everything that I'm going to talk about today is framed within that lens of health inequalities, because ultimately that underlines everything that we're doing when we think about food environments. And we also know that when we look at density of fast food outlets, they're linked by deprivation, and there's also an association with obesity and patterning of obesity as well. So there's a lot around the environment that links to our individual health outcomes. Translating that into hard evidence is a bit more challenging. So how can we influence food choice through the food environment? Well, what we eat is automatic. It's often habitual. We don't necessarily think about it. It's around who we are. We're in Belfast this morning. Some of you might have had potato bread for breakfast if you were lucky, or pancakes. It's that wider environment, and those choices nudge us and push us into different directions. And like I say, often we don't even think about why we're eating what we're eating. It's largely driven by what's available in the environment. And I'm sure that's something that Sinead will pick up in her presentation next. So what are the opportunities? I'm not going to dwell on the much work that we do need to do. We need to think about, okay, what are the opportunities? How can we change behaviour? And very briefly this morning, I'm going to cover retail, planning, advertising, and food security. I'm very lucky that Sinead's going to pick up on the food retail in a bit more depth. I'm not covering supermarkets. I know that Fran will cover the advertising in more depth, and my colleague Heather is going to pick up on the healthy planning. So I'm going to give an overview, but if anyone wants to discuss in more detail, I'm very happy to talk in more detail. So, food retail. First, I'm going to mention briefly, I don't have any results to share with you at the moment, is around looking at fiscal measures, looking at food taxes. So, Aileen already mentioned this morning the success of the sugar levy, and there was more data just at the end of last week came out from a study from Cambridge looking at dental health and the positive effect that the sugar levy has had on the dental health of children. So we know that has been a success. So in last year, 2021, NIHR funded 3 studies looking at food tax. And I am part of one which is with a wider team led by Dr. Penny Breeze at Sheffield, health economist, and also including the team at City in London. And we are exploring what high-fat sugar and salt food taxes are feasible. So what is going to be feasible? Then in terms of the economics, what will have the greatest benefits to health, labour, work outcomes, household expenditure, as well as sustainability and inequalities. So it's quite a lot that we're doing. So it's going through, we've gone through the work package 1 looking at the rapid review. We've engaged with our stakeholders as well as the interviews, and we've conducted the media analysis. So we're now working through the work package 2. So this is a work in progress, and I'm sure we will be shouting loudly about it when we have completed this study. Another piece of work around the food retail environment is thinking about fast food outlets or the out-of-home food environment, focusing mainly on fast food outlets. So this is a piece of work that was funded by the NIHR School of Public Health Research, of which we are a member through FUSE. So FUSE works across the 5 Northeast universities, and Teesside is one of those. And we were looking to see, okay, we've got these out-of-home food environments, how do we work with them to transform them, to make those outlets that are already there, people are using them, what can we do to make them healthier? What little tweaks can be done? And this was a process that involved evidence synthesis, and from evidence that also included looking to see what are local authorities doing, so what's actually happening in practice. Might not be published in a peer-reviewed journal, but there's lots of activity, what's going on, through to stakeholder interviews, and that then led into intervention development as well as feasibility and acceptability testing. And those included salt reduction, so looking at moving from a 15-hole salt shaker to a 5-hole salt shaker. And we have published on that, and unsurprisingly, that reduced the amount of salt when people poured salt at the fish and chip shop, through to running master classes for businesses about how they can make changes within their business to make that food that is served slightly healthier or more healthier. And then this one here, which was working with the suppliers to develop a smaller box for a light bite box. So not saying that, no, you can't have this food, but actually saying, here's the food, but here's a smaller portion size, and looking at the impact that could have. And when the suppliers, fish and chip shops in England is quite unique, that there are very few suppliers and they cover a huge geographic range, so that can have a huge impact in terms of looking at calories consumed. So, healthy planning. Planning and public health emerged together as the Industrial Revolution happened. So they came together from a common sense of needing to improve things like sanitation. As time went on, the planning departments and the public health teams grew apart, but over the last 10 years or so, there's been a coming together, bringing together of people working together, realizing that actually planning can be used as a tool to try and shape healthier, not only food environments, but environments for us to be physically active in. So it might not necessarily come naturally to a planner to think about actually health is something that I need to do. I know that the National Planning Policy Framework is for England. It doesn't apply to Northern Ireland or Ireland. Sorry, I'm not an expert in that, despite the fact that my dad worked in the planning service in Oma all his career. But I did ask him yesterday, and he was like, "No, I have no idea." I was like, "Okay, right." I tried. His thing was about conservation, and so he leaves a legacy in conservation, but not in healthy planning. That's my job. So there is a bit of a culture change, and there is a bit of a shift, but as I will come to later, that's not universal. But we need to work together across disciplines to try and shape these healthier communities. So we've done some work around looking at planning appeals, which is the process by which, say, a local authority rejects, say, a takeaway restaurant, and then that business might go to the planning inspectorate to say, we want to appeal this, and then it goes through an independent process. So we were looking at the appeal process and working with the planning inspectorate. And this is where, this boils down to what are the essential ways that two different disciplines, two different departments within the one organisation, because in England, the public health teams now sit within a local authority, and they have done since 2013. So every Wales is different, Scotland's different, Northern Ireland's different. But since 2013 in England, they're in the same organisation, but not in the same department. And the fact that what makes something successful to try and help shape a healthier environment is around communicating between professionals, not surprising, knowing where to find data and sharing the data. So planning professionals won't necessarily know where to find data looking at health outcomes in relation to the environment. Understanding evidence and understanding the importance of health. Many of these get rejected around things like litter, not necessarily health outcomes. That's more what planners understand, litter, noise. Having updated systems and actually building on the passion of members of staff who are really passionate about shaping the environment. So a lot of these aren't necessarily work systems, they're about the individuals. We have published this in Perspectives in Public Health that just came out in September. So there's more detail on that. Now, COVID, that was a big impact on our food environment. Our food environment became our home food environment, and for a lot of us, we did a lot of cooking. We became school dinners, we became snack providers, but it also had a big impact around the planning legislation. So rules were relaxed and everywhere could become an out-of-home environment where deliveries could happen, where takeaways could happen. And at one point, it looked like that might not be reversed. And we worked with what was then Public Health England, now is OHID, and looked at what was the impact, what was happening. And there was a big impact, and the rules did go back to normal. And we have followed up on more work, and I think Heather might look at the data around that. I'm hoping you are going to share that slide. Fabulous. COVID had an impact on our food environment, and I think we're still working through what the impacts of that are. One of which are dark kitchens. Everybody familiar with the term dark kitchens? Sometimes called cloud kitchens. So basically it's somewhere where food is coming out, but not necessarily any customers going in, so they're not customer facing. And Heather and I are very excited that we've got a small bit of NIHR funding to start to look at this and explore this more, so there is more coming soon. But what can we do now? What are the opportunities? There is some guidance that we produced with what was then Public Health England around using the planning system to promote healthy weight. It's a useful tool to have a look at. It's different countries, different systems, but still will be useful. And we have had for quite some time some CPD training coming out both for planners and public health teams. It's got stuck in OHID, but that will be coming soon. And again, whilst it's focused on England, I think it'll be useful for other countries to look at. So the opportunities are the fact that we need to get different professional groups working together within the common goal of public health, not only to readdress healthier food environments, but also to think about wider things around physical activity. But the focus today is on healthier food environments. And there's so much more to be done. At one stage in England, we talked a lot about levelling up. That seems to have gone a bit on the back burner, but there is a lot of levelling up to be done. Changing planning legislation, which is happening in England as well currently. There are lots of policy levers. We in public health don't necessarily understand what they all are or how we can use them. We need to work with businesses. We are not, as public health professionals, we are not anti-business. We want to work with business, especially the smaller local businesses, which are the majority that we see on many of our high streets. We need to think about reviving our high street and creating this concept of healthy high streets and thinking beyond the high street, thinking about what's the new frontier. The food environment is constantly changing and evolving, and the new frontier is the delivery services. At the moment, there will be something else in the future, but that's our new frontier. And we have to think about this in terms of food systems and challenging and looking to address food systems and working locally as well as nationally. So, advertising and marketing, and I'm sure Fran from Sustain is going to cover this in much more detail, but just briefly. Everyone's familiar with the junk food ad ban on Transport for London. And I was part of a wider team, again funded by the School of Public Health Research, evaluating the impact of that. And there are a number of publications that came out of that work, going from the media analysis of the ban, which is in itself fascinating. Similarly, the media analysis when we've done around food tax also is fascinating, that interpretation of these public health policies by the media and therefore by the public. As we know, that has been a successful intervention, and we're starting to see other places pick that up and think about how they're going to do that. On a more local level, we did a piece of work looking at bus shelters. So Northern Ireland, probably more generally the island of Ireland, relies on buses more than necessarily train networks. And bus shelters have been used to advertise lots of things. We did a piece of work in the northeast of England, in Middlesbrough and Redcar, both quite deprived areas, looking to see what was on, at one point in time, what was on those bus shelters, and then coding them according to the HFSS categories. Again, there's a paper published and lots more details than that, but you get interesting situations like very clearly something advertising a very famous fast food outlet. However, they're not advertising food. So lots of interesting things around advertising, and that I'm sure Fran will pick up on much more of that. In the time I have left, what I'd like to talk about is food security and the importance of this now, the importance of this in relation to health inequalities, the importance of this in relation to the food environment. So we did a systematic review and a meta-analysis looking at the influences of food environments, food insecurity and obesity, particularly focused on high-income countries. And this was work carried out for Fatima's PhD. And across 24 studies, both adults and children, we found a small but statistically significant association between food insecurity and obesity. So, this is something that other studies are showing as well. So from that, we can conclude that, it's likely that individuals experiencing food insecurity are likely to be affected by obesity as well. So there's this tying together of different themes. And if you think back to my slide at the beginning where I was looking at the patterning of and density of, for example, fast food outlets, we're starting to see a picture here of wider inequalities that need to be addressed if we want to improve people's food environments and therefore their food intake. And then thinking to food parcels and food banks, because people are getting food not just from the retail environment. The places people are getting food from now is different. People get food from food banks. People are getting food from social supermarkets that pop up. There's a whole different sector that we don't necessarily, as public health teams or as policymakers, have our eye on. When it comes to food banks, this was some work led by Lucy Oldroyd, and that, again, a lot of this isn't necessarily published evidence, but this focused on the published evidence. There was not a lot of data, and what data there was showed that probably these food parcels are nutritionally poor, not necessarily designed with particular subgroups in mind, like people living with diabetes, for example. So there's a lot more to be done on that. Additionally, I just talked about community supermarkets. So community supermarkets are called lots of different things. They might be called food pantries. They exist everywhere. They often use surplus food. People pay a nominal amount, so there's a bit more dignity, a bit more autonomy, where you're going in and choosing, not being handed a food parcel. But we don't understand how people either use this food or what the food is like, because it's surplus food, it changes week to week. And it's a very challenging environment in which to try and do an academic, rigorous study. For example, people don't necessarily want to show you their lists of what food is coming in, because there's, lots of small organisations working together. But we've been trying to understand in Middlesbrough and Stockton and slightly wider how they shape and access and availability to healthier food. We have been trying to explore how they're used more widely in the UK and internationally. Again, trying to do academic systematic reviews has been quite challenging because there isn't very much published. It's mostly grey literature. Trying to look and work out what the food system is, and it's food coming from lots of different places, how they're perceived by people. And within Middlesbrough, these shops are called eco shops. So we're trying to take, they were set up to destigmatise. So it's about taking food away from landfill and reusing food. So it's supposed to be for everyone, but they are mostly in quite deprived communities. We've done lots of interesting work around using peer researchers. So academics are not, people in those communities are very unlikely to speak to academics. So we've trained up peer researchers who we work with, who've also analysed the data. So it's been a very long process, but really very insightful, and don't have results yet. We're nearly at the end. And then there's another body of work, again, thinking about food insecurity, but this time thinking about people living with severe mental illness. So along with my colleagues, Professor Emma Giles and dietitian Joe Smith, who we have a joint post between one of the NHS trusts and Teesside University, we've been exploring how these group of people access food, what food they access, the fact that they are much more likely than the general population to experience food insecurity. And from that work, we're kind of combining the previous work around the social supermarkets, and we've just been funded by NIH Arts, just in that top corner, to work with a group of people living with severe mental illness, as well as those social supermarkets, to try and develop, through weekly cooking groups, try and develop a healthy, ready meal type product that will be on the shelves of the social supermarkets, designed by people living with severe mental illness. So kind of bringing that surplus food, that sustainability element, through to working with the peer researchers and people with lived experience, through to an end product to try and challenge this very difficult situation that doesn't seem to be going away. And in fact, we're just seeing more and more people living in food insecurity. So that has been a whistle-stop tour around retail, planning, advertising. I know you had your event on food insecurity last month, September, 2 months ago. I'm very glad that there's going to be much more detail from Sinead, from Heather and from Fran around retail, planning and the advertising and marketing. Will we see new policies? We can live in hope. There is a lot more work to do. There are a lot more policies to create, maybe even some new levies on food. Who knows? At the moment, food tax and fiscal measures isn't a very popular term, to say the least, or even a dirty word. So who knows? Will we see new opportunities? I think in terms of opportunities, we can try to co-produce our research. We can aim to improve access to food. All of this needs to be done within a lens of sustainability, partnership, thinking about those health inequalities, those wider food systems, working with policymakers, involving the public, thinking more broadly about how we translate our knowledge and that knowledge exchange process. And there is much to do, and much to do across so many different disciplines. Thank you very much for your time. If you'd like to find out a bit more about Fuse and the work that we do around translating knowledge, it's a very simple website, fuse.ac.uk. There's lots of Fuse briefs about some of the research that has come out on a very broad range of topics, not just food, and as well as our Fuse blog. So if anyone's interested in writing a public health related blog, do get in touch. And we also now have a Fuse podcast. So yeah, lots of communication and dissemination tools on there. So thank you.
Thank you, Amelia. Brilliant presentation, and I think lots to think of. And thanks for highlighting again how the food environment is even less supportive for those living in areas of high deprivation and for the more vulnerable ones in our society. We have some time before we have Sinead joining us for our presentations. I don't have any online questions, but I'm wondering if someone here in the room would like to take this opportunity to ask Amelia a question? No?
Baffled. Okay.
Thank you, Amelia. I'm sure we will have loads at the Q&A section.
So a lot of the stuff that I'll be talking about today has all been joint work with Amelia, who spoke earlier. So there are some similar-ish slides, so I'll just go over those quickly. So I start with just describing the food environment, but from the other presentations, I think everyone knows what that is. And I guess just one thing to add on to this is something that we are looking at now in some future work is kind of the online food environment and how that fits within the physical food environment and possible ways to think about regulation and understanding what's happening and how that influences people's food choice and who's using this online food environment, because that's much less well known. And then I guess another key thing to think about is that how we measure the food environment, and some of that depends on who you ask. So particularly in England and Wales, is that people working in different kind of places classify it in different ways. So we can see public health teams, environmental health officers, and planners would all kind of classify food outlets in different ways. So I guess everyone's more familiar with the public health, kind of the high HFSS. So that would be one way to kind of distinguish different types of outlets. But then planners think of it more in terms of building use. So that also then there's kind of, that creates a bit of gray areas. So you'd have things like hot food takeaways. So for a planner, that would be something where you can't sit down and eat. So you'd have things which us, like McDonald's, would not be considered a takeaway, even though that many people would go there and take food out because they have tables, or KFC. And so kind of many of the hot food takeaways are smaller, independent businesses that just sell food that you grab and go. And then I'll get into it, I think it's the next slide. So environmental health officers as well think of it in terms of food safety. So you have fast food, which could include both McDonald's, these small independent takeaways, and sandwich shops, which are also a grab and go type thing, are all classified together in some of the data sets, like the Food Standards Agency Food Hygiene Rating Scheme data, which is a mouthful to say. And then you have other things like restaurants. So again, would McDonald's or things like that, would that be classified as a restaurant or fast food? And supermarkets and things. Okay. So I've touched upon some of this. So I guess the other important thing to note is that in 2021, in England, and I think Wales as well, or is it just England, Amelia? Just England. They changed some of the planning guidance. So what used to be considered an A5, so that would be planning use for hot food takeaways, now is called something different, which I can't remember off the top of my head, and it's all sui generis, meaning so that there's effectively a blanket ban on changing the use of a building for this purposes across England. But as I mentioned earlier, the uses are not always clearly defined, so there's a possibility that some businesses could slightly game the system by putting in a few tables. So, and I guess since this policy is still relatively new, there hasn't been much analysis on what this means for kind of the opening of new outlets, as far as I'm aware. And this is just to say, this data set is amazing, is that because I guess it's a statutory requirement for every food business, definitely in England, to be registered within 28 days prior or after opening, so that this is a wealth of information on any place that sells food that is not served only at room temperature. So it includes things like, schools, hotels, church halls, so you have everything. And it's all online going back to 2012. So it's really a valuable source for kind of understanding how the food environment has changed over time as well. So I guess from about 2010, similar to what Fran was saying, this all kind of, I guess, started in London and then kind of spread out from there. Many local authorities, and I guess this also kind of coincides with the move from public health to local authorities, implemented what were called supplementary planning documents. So this builds, I guess, on the local plan, kind of the vision that they saw for their local area and what would be available in their local areas. So we know that important health inequalities exist around access to healthy and unhealthy food. And we could see that in the diagram that Amelia presented for the map of England, where we saw that there was different concentrations in different areas by area level deprivation. And so I guess what we could do then is, within, I guess, the constraints of the powers granted to local authorities, is that you could restrict what new businesses came in. So you can restrict what's already there, but you can say that a local authority could say, we do not want to have any more new takeaways. So it's saying that if a business applied to change the use of a building to a takeaway, that then you could say no. And I guess in about 2020, 2021, approximately 50% of local authorities had these type of planning documents. And there was 3 different types. And some of the work that I'll go into, we've explored these different types and what they mean. So one of the most common ones is a school exclusion zone. So this relates to all the, I guess, evidence around increasing rates of childhood overweight and obesity. And so usually it restricts planning permission for new takeaways within 400 meters, mostly of a secondary school, not so much a primary school. And then the other one, which is less common, was limiting the density of fast food outlets. So you could give a certain kind of figure and say that if there's more than this concentration, we're not going to allow any in. And then the third type was specifically based upon childhood obesity rates from the National Child Measurement Program data, which says that if childhood obesity rates were above a certain level, then in that local area, there'd be no new A5 premises allowed. So in the northeast of England, multiple different types of this policy were implemented. So in Newcastle, they did school exclusion zones around, I think the number, I'm going to say it was about 14 secondary schools in the Newcastle area. Whereas in Gateshead, they did something completely different. They basically did all 3 of the different types, which was effectively a blanket ban across the whole borough on any new A5 premises. So what we can do is compare and contrast the different types of policies and understand what influence that had on the food environment. And then we also look at what influence that had on children's weight outcomes. The only problem was that we had COVID, so we only looked up to 2020 because you say that, and as Amelia highlighted, planning rules completely changed, so the policy in effect really only lasted to 2020, so we can't say anything after that. Okay, so this is the planning rules in Newcastle. So these little red blobs are the school exclusion zones. So the secondary schools are all in here. The little red dots, sorry, I know these are probably not the best colors, especially if you're colorblind, but hopefully people can see that. So the red dots are takeaways within the school exclusion zone, so those were already there. The green dots are those that are outside the school exclusion zone. So what we were kind of looking at is how this changed over time. So in theory, you should get no more new red dots, but there's nothing stopping new green dots from happening because there's no regulation around that. And so what we found, and I guess one of our hypotheses was that then businesses would just open just outside the school exclusion zone. And here is some evidence, and we looked at all different types of businesses that were in the data to see, I guess to filter out some of the noise, because you wouldn't expect some other businesses would be unaffected, so any change in the growth of those would be independent. And we found basically that there was no significant effect. So this is the dot for takeaways right here. So it did decrease in the exclusion zone compared to outside, but not by a statistically significant amount. And then all the others were insignificant, so that's kind of what you'd hope to see, that there was no big change anywhere else either. And so then the next thing we did is we looked at the policy in Gateshead, which was effectively a blanket ban. So then we could compare across the two different types of policies. And because it was across the whole borough, when we did the analysis for Newcastle, we used the other areas as a control. So the analysis was all within Newcastle, but this one we couldn't do that. So we used, we did the analysis at the lower super output area, which is a small geography of approximately 1,000 households. So it is bigger or smaller depending on the concentration of the population. So urban areas are quite small, rural areas, they can be massive. And we matched them with other local areas in the northeast of England, which didn't have any planning guidance at the time. And we used a propensity score matching to do that. So then these are the treatment and control groups. So the treatment is Gateshead, the controls are these other ones, and we can look at the growth in fast foods. 2015 is the year that the policy came in, and we can see that there was a decline of new outlets in Gateshead after the introduction of the policy, and that there was effectively a change in the trend from this policy. So we did find that both the density and the proportion of hot food takeaways compared to other types of outlets changed as a result of the policy, and this change was statistically significant. So we found it decreased by 12.45 outlets per 1,000 of the population, and 13.8% proportion. So there was 13.8% less hot food takeaways compared to other type of food outlets after the introduction of the policy. And then, so the next thing we did is after, I guess, we established that this policy did lead to a significant change in the food environment. We looked at, so what does this mean for children's health outcomes? So does having this kind of change in what's available, does it impact on childhood's weight? And I guess how long would it take? Because you'd think that it's not going to be immediate. So, and I guess the unfortunate thing is that because of COVID and changes again in planning, we don't know kind of the longer term impacts of this type of policy. But I guess possibly the positive thing is that now that all new takeaways are banned, that there is going forward some chance to do some type of analysis. So we did find, and I guess this relates as well to the picture of England that Amelia showed with the density of outlets. So even within Gateshead, you have obviously areas with higher deprivation and areas of lower deprivation. And there was, in the index of multiple deprivation, so we broke that into quintiles. So the fifth was the least deprived, the first was the most deprived, and the quintiles with the highest concentration of hot food takeaways were the second and the third. So those are towards the more deprived end, but not the most deprived. So the most deprived area didn't have the highest concentration in Gateshead. And so we can see that these are the density of fast food outlets. So then this one is the least deprived, so you can see that there's less throughout the whole period. The most, so this is the second quintile, so you can see that these two quintiles have the highest concentration, which are obviously highest throughout because it doesn't close new outlets, but it doesn't increase at the same rate as before. And the interesting thing is to compare it to the control group, so we can see that there is still this upward trajectory over the study period, which we had not seen, which we don't see in Gateshead. And this is then using National Child Measurement Program data for overweight and obesity rates. We look at changes in rates over our study period, and we can see that overall, the highest deprivation, it increases and then decreases, but overall we can say it keeps relatively steady with some decreases in those areas that had the highest concentration, which would suggest that the policy has, in the short term, had some impact on childhood overweight and obesity. It is very small, but it has had, compared to the control groups, there is a statistically significant difference for those areas that pre-policy had the highest concentration of outlets. And this is just those coefficients. So we can see these here. So basically there was a 4% reduction in obesity rates in the second and the third quintile compared to the control areas after the policy. The others were not statistically significant. And I guess the other thing to keep in mind is that we don't use individual child data, so we don't actually know the length of exposure, because one of the things that we did explore kind of is moving, so that how, and there was a lot of child movement, particularly in areas of higher deprivation, because I think if children are in rented homes, they might move between these areas. So that is another thing that the context of that needs to be considered when interpreting the results. And then, because the project was slightly scuppered because of COVID, we thought we would do something during COVID to look at how that influenced the food environment and what that means for kind of post-COVID planning policy. So, and I guess another thing to keep in mind is with the data. So, prior to COVID, environmental health officers would physically inspect premises. During COVID, that didn't happen. They were doing online inspections of any new outlet. So that might also, and because environmental health officers were being seconded to do other things as well, that the data is slightly less reliable, because a lot of it they were not input. Normally they input it once a month. This wasn't necessarily happening. There'd be big, like every 6 months, they just put lots of data in. Some local authorities, did it 8 months, 12 months, but there wasn't this consistent inflow of new data. So that is also just needs to be considered, that there is some variation in data quality over that time. And there's also some, I guess it was how they put it in, there's a lot more duplicates than you get normally. So we had to do a bit more cleaning of the data. So this just shows this is for all of England, the average number of fast food outlets which are classified as fast food or sandwich shops. But we did some also cleaning based upon name to kind of filter out very obvious sandwich shops. So you can see that over time this has just been gradually increasing. And the same thing, this is restaurants, so over time that has also been increasing. And then this is for pubs and supermarkets. So I guess we looked at, I didn't say this, across different types of food outlets to understand how they've been changing over time. So we looked at takeaways, restaurants, pubs, and supermarkets to see kind of how COVID may have changed business decisions and what that means for thinking about planning going forward. So I guess not surprising, overall the number of pubs has been decreasing. And that's probably independent. There's other factors at work there. And number of supermarkets has been, again, similar to restaurants and takeaways, has been increasing. So you can see that gradually over time, the type of outlets that are selling food are changing. And then we also looked at the growth of chained and non-chained food outlets to kind of understand who's operating in that space. So the darker line is fast food chains, and the other one is non-chains. So you can see that over a COVID period, kind of fast food chains, not opening so much. There's still small growth, but non-chains, that was the people who were opening during the COVID pandemic. Okay, so what does this all mean? So what it basically says is if you're taking a whole systems approach, that these planning rules, if you use a blanket ban, that does make a difference. It does change kind of, because a lot of these things as well, I guess going back to this slide, we can see with non-chain food outlets, that many of these premises are run by small businesses. The rent on a lot of them are usually quite cheap, and the capital needed to set up these businesses is not incredibly high compared to some other type of businesses, so that there's a lot of, and this was something that the environmental health officer would say a lot, is there's a lot of churn in the market. So there's a lot of new businesses coming and going, and that then influences, I guess, as well, what happens next in the market. So saying that this type of thing might then prevent new places from opening. So it doesn't stop the places that are already there from existing, but it does seem to have a difference just because of this, I guess, the dynamicism of the market. And that we did find that for those areas with the highest concentration, there was a decrease in population level childhood overweight and obesity at age 10 and 11. And that the COVID pandemic did have a big impact on food outlets, and that will shape the food environment going forward, and as well changing people's kind of consumption patterns. And so then other things to think about, and this is some of our future research, is, and I guess this is something that people mentioned when we presented this stuff before, is saying, oh, but the physical food environment is less important. What about food delivery? And I think, especially from an inequalities perspective, I think it's really important to understand who's using food delivery. And I still think there is a role for the kind of physical food environment if you think about who's using what and where. And I think we need to understand that better to make the case for regulation and legislation, and understanding what. So then we have dark kitchens, and as Amelia said, we have a new project that should be starting, I'm going to say February, March time. And so we've started conversations with environmental health officers around this, and a lot of things that comes up is because dark kitchens kind of sound, or at least to me it sounds quite negative, so thinking of another way to classify that. So one of the suggestions we had is delivery-only kitchens, so thinking about kind of, where they are, because some of the research on them has been, well, pretty much all the research to date on this has been in London, and London is very different to other parts, and to think about, who's running these type of businesses in other places, who's using them, and what that means for kind of what people are eating, and as well as food safety was an issue that's raised, because a lot of our discussions with people in the north of England is that Facebook Marketplace is one of the things that they think of as kind of delivery-only kitchens, as people operating from out of their house, and some of them might not know they're supposed to register their business and do food safety training, and so that then create issues. And then the other kind of area is, which I've discussed briefly, is the idea of drive-throughs. So it's kind of businesses saying, well, if we can't operate this, well, we'll do this in a slightly different way. So it's thinking about, what are all these alternatives that business can do and how those impact then on our food environment. And then these are just some references to papers I've discussed. And that's everything.
Thank you so much for a brilliant presentation, and it's good to see that some of the policies are already having a positive impact. Are there any questions for Heather now in the room? Yes, we have a question there from our colleague Susie. If someone could hand over a mic.
Hi, I'm Susie from ICPO, and I'm representative with the Association for the Studies of Obesity Ireland. In the Greystones County Council had a no-fry zone where they weren't to build any fast food outlet within a radius of schools. And the Association for the Studies of Obesity Ireland actually sent an award to them to say, well done on addressing obesity. And about 3 or 4 months later, they opened a takeaway within the school radius and said that they changed their criteria. I don't know how we can address that. We actually debated asking for the award back, but we didn't. So I even don't know how to pose this question, but what do you think we could do in that situation?
I guess, so that's kind of one of the things that we found with the Newcastle one, is it's almost the school exclusion zones, it's not enough, because there were a lot of exceptions with how they wrote the policy. Because I guess it also relates to some of the stuff with Fran said about the the kind of the lobbying, and there was a big fear about being seen as non-business friendly, and how you kind of can I guess overcome some of those negative, I guess, kind of ideas. And part of it, I think, is there's not a lot of analysis about the kind of economic impacts, or even the economic impacts of these businesses on the community. And so I think Gateshead, in a way, is a really good example, showing that, this blanket ban, it didn't impact on business rates. That there was no negative economic consequences. Similar to some of the stuff that Fran showed, is that people have these expectations which aren't necessarily borne out in the data. And I think it's just really having a tight policy where you say that, X, Y, and Z cannot be here.
Thank you. I'm going to invite the other speakers now to join Heather. We have Fran joining us remotely too. And we will start our Q&A session. So for everyone in the audience here today, raise your hand and our colleagues will approach you. For everyone at home, use the Q&A function on your Zoom at the bottom, and please let us know which speaker you are addressing when asking your question. And I have some questions already online, so we can start with that. Sinead, your research looked at placement of unhealthy foods against fruit and vegetables. Did you consider comparing with other healthy food groups?
Yeah, it's a really good question. I suppose what we used was a validated proxy measure. So the study in New Zealand that validated that measure measured an entire supermarket and then used statistical analysis to see which groupings of food best represented the availability of healthy and unhealthy foods in the supermarket. In the study, we visited 36 supermarkets. It's not viable to measure every food in the supermarket. Even just doing the proxy measure in some supermarkets took about 7 hours. So the proxy measure was validated as a representative measure. We did talk about should we maybe change it slightly for the Irish context, but if we do that, then we're not following the validated measure anymore, and it's no longer comparable with the other countries where it has been implemented, like Australia, New Zealand, it's recently implemented in Belgium. So it's good to stick with the validated measure so that our findings are comparable, and so that's why we use that.
Thank you, Sinead. We have two questions there.
This question for Fran. London was the first to implement their advertising policy. What was the driver for this, and who drove its success?
That's part of that question. Is that just the local authorities that first did it?
So I was just saying that London was the first to implement the policy, and what was the driver for it, and who drove its success?
Yeah, it's a really interesting question, actually. I think it's kind of a number of different factors. It's kind of looking at the different levers that the Mayor of London had. Actually, I suppose like a lot of local governments and local public health teams, there are certain remits that are available to them. For the Mayor of London, the transport system is under his remit. So it was an area that we could look at, and when the London Food Strategy was published in 2018, it was something that was put forward by the London Food Board. So there is actually a food board that feeds into the Mayor of London's team. And there's actually a very forward-thinking kind of approach to food within the regional government in London. They actually have a food team, unlike kind of pretty much any other local government system that I've worked with, which means that actually you have less of those food issues falling through the cracks. So not only is there a staff team looking at it, but also the food board, which is made up of something like 15 different food experts across London who advise the mayor. So all of that combined to result in a really well thought through kind of holistic approach to food within that London food strategy. It's something that I would recommend to all governments looking at how to improve food, because you really need that kind of wider approach to look at all the different things. So that actually, in a way, so you can pass policies that are so niche like this, because you need to be able to say, actually we're looking at this in the round, and this is one of the factors. So yeah, I think it's a lot of different aspects of the sort of structural work in London has meant that it was able to be supported forward.
Thank you. And we have another question.
Thank you. This is for Sinead. I'm interested, the 2 supermarkets that declined to take part, what do they give any reason why? And conversely, I'd be interested in the motivations for the 3 that did take part. Thank you.
Yeah, it's a good question. One of them didn't give a reason why. And the second one actually later agreed to participate, but the study was already complete. So that was unfortunate, because it would have been great to have as many as possible. So I think it's a really good indicator that the retailers are willing to get on board with this. And I suppose the offer from our side was that we would give them a report back communicating the findings from the research. And that was, I suppose, what we could offer them from the study.
Thank you. We have a question there.
Thank you. My question is to you, Sinead, as well, following on from that question, actually. Is I'm assuming that, maybe I'm naive, I would imagine the supermarkets know exactly how much shelf space is given over to high fat, high sugar, high salt food, and how much is given over to health. So given that you've just said you gave them a report, I would imagine it's only confirmed. I mean, this is kind of almost a nonsense question, but you would know, and is that available? That information available, or could you get that information? No.
It's an interesting question. I think it depends on what measure of healthiness you're using, how they would quantify what's available in their stores. I'd say with the implementation of the HFSS rules, there's a better understanding now than when we started having this conversation with the retailers first in 2019. The retailers are aware of, from my experience, some of the retailers were aware of where some of the foods are located, but maybe not the ad hoc positioning of foods, that it might just have been put there by the store managers at that time, stacks of confectionery in the middle of the fruit and vegetables, or confectionery or drinks on shelves above other areas of display where you wouldn't expect to have them. So I think they understand probably the ratio of the foods that they're purchasing in to sell, and now with the HFSS they know the nutrient profiles of a lot of those foods, but I'm not sure they definitely know of their overall floor space, how much of that is given from a ratio of healthy to unhealthy. I wasn't made aware anyway. If
Then can I ask you, once you give, do you mind? Sorry. Once you give them the report, then did they come back to you to say that they were shocked, or there was something that was going to be done about it, or?
Yeah, they were very engaging, the retailers, and they really engaged. And because I work now on the Food Reformulation Task Force, we're engaging with the retailers on an ongoing basis about the nutrition composition of foods as well, and the retailers are really engaged in that process. So the purpose of the study wasn't to propose a healthy in-store intervention, so we didn't have that type of conversation, but they were definitely very interested in the results.
Can I just add here as well? Sorry, I mean, I think actually what Sinead is saying is right. Actually we see all the time that there is real inequality of access to data. So actually there is real validity in making sure that policymakers, NGOs, and anyone else working access to data that is required in order that we can evaluate what's going on, but also propose useful policies. So it is so essential that we can get some kind of grasp of what those numbers look like in order that, groups like, a company, well, charities and other groups can actually advocate for effective policies that can try and influence that. So yeah, it's really useful to try and to get some of that data that is open access and we can all see.
Thank you. Thank you. I'm going to go over to Hannah for a question now, then we'll go online and I'll go back then to you.
This is a question.
I don't think you need to turn it on.
Oh, can you hear me? Yeah.
Yes.
So this is a question for Amelia. Is there a need for different policies to create supportive environments in the food environment in the deprived areas? So we heard from Sinead how there weren't even supermarkets in the most deprived areas in Dublin. So kind of how can we address that at a policy level?
Oh, wow. I think we need overall policies to address healthy food environments, but I think we now need to expand that to broaden what we understand as a food environment. So and probably Fran can speak to this as well, that concept of people getting their food from a supermarket might not necessarily be the case, and I don't think as policymakers or even practitioners or academics we're fully appreciating the range of places that people might get their food from. So I think we need policies to address what that choice environment looks like, and Sinead's work is so important in that, and just in trying to get a handle on what that looks like. Well, we all know what it looks like because we all this is a area where we are all using our own lived experience as well. So we need overall policies, but we also need policymakers to be in places like Middlesbrough, or in Northern Ireland context to be in Omagh or Castledurg, or to understand what does a food environment look like to people who are using that space. But also we need people whose responsibility is food, and Fran gave that example of London, and look what happens when you have people who are responsible for food, not just different aspects for food, but that wider food system. So yeah, we need system change, but all of that needing to be framed within that inequalities, because that is the biggest issue, and I think it was very nicely illustrated in your work and also in our work around planning as well.
Thank you, Amelia. And that leads us into an online question for you, Fran, really nicely. Are you able to comment on the impact of the healthier food advertising policy in deprived areas?
That's a really interesting question, because we expect there will be a bigger impact of these policies, policies to restrict unhealthy food advertising, particularly in deprived areas, because we know that people from more deprived areas are more exposed to unhealthy food advertising. That's been shown through numerous studies, both in terms of more unhealthy food advertising within deprived areas, when you compare them to less deprived areas, but also, really interestingly, a study in Scotland followed young people on their journeys to and from school and other places, and they found that actually it wasn't that the unhealthy food advertising, there was more unhealthy food advertising in their neighbourhoods, but actually because they lived nearer transport hubs, so busy roads or train stations or other busy places, they were exposed to more unhealthy food advertising when compared with their colleagues who live in kind of the leafy suburbs, who probably would be taking much quieter routes into school. However, having said all of that, so we expect there to be a big impact. The studies so far haven't yet, I suppose they haven't been so focused specifically on that question, although they have indicated there is likely to be some impact, and this needs sort of further examination. So unfortunately, the actual kind of hard evidence we don't have yet in terms of this impact. However, we have seen there is a big contrast between more deprived exposure to less deprived exposure.
Thank you. Charmaine, you have a question?
Thanks, Joanna. Super presentations from everybody. and can I thank you. A question, please, in relation to citizen engagement. So, Amelia, you talk about the importance of the lived experience and ensuring that's integrated. Fran talks about, being discreet in terms of policy implementation. So, there's a very big, there's a very big continuum, I suppose, in terms of how you approach these things. But can I ask you to reflect on the role of citizen engagement, if any, and that's a question, I suppose, for you all, in terms of the role of citizens in terms of providing the lived experience, the advocacy, the support, the political pressure, or any of, or any mixture of the above. So, how do you feel that citizen piece is important or otherwise?
Sure, go first. I think it's so important, it's so hugely important, and I think that no-fry zone example is an interesting one in terms of where was that supported by the public? Was that a public movement? And we have seen a number of cases in Newcastle and otherwise campaigns to prevent. It's usually one of the big multinational fast food chains from coming into an area, and often that's what overturns planning, is the passion of the people living in those areas. So that's thinking about it from a planning perspective, but also a lot of the food advertising, we're seeing a lot of advocacy coming from young people, and an organisation called Bite Back 2030, but I'll let Fran speak more about that, saying why are you advertising to us? But in terms of lived experience and understanding that access to food from people who are living in that, we as researchers don't necessarily live in those communities. We need more diversity in us, and that's why we need to bring on board peer researchers or even people living with severe mental illness, for example, in that piece of work, to understand that and to make research that's going to be real in terms of it's real and realistic in terms of its implementation.
Yeah, maybe I can build on that. So before working in the FSAI and in the Irish context, I worked in humanitarian and development work overseas, and in some ways they're much further along in community participation in intervention planning and service planning than maybe we are, or maybe that I'm aware of. Anyway, and there was an approach we used called the community scorecard approach for various different interventions and services. And I just wonder, is there space to start building that community engagement and momentum around their own food environment? Not the idea of community gardens and kitchen gardens, which I think is maybe what people think of when they think of but actually outlets that are available to them and the retail environment, and to start collecting people's voices and give them a tool to contribute and show their preferences, because I'm not aware of things like that being done at the moment, but I think it's a really important element. Sure.
And I guess building upon that is kind of the idea of research as advocacy, because Fran had talked about the lobbying, and I think especially with local government, that if you get people in the community on board and they kind of have a vested interest in it, councillors really are concerned with what people think, and that I think is a really great way to make sure that these policies go through if they have that community support and getting people involved. It's something that they feel like they have also accomplished, because in the day it's where they live and they can help make it a place that they want to be.
Would you like to add to that, Fran?
Yes. So I think this is really important from a number of angles. I think the other speakers have spoken to this really well. First of all, there's the aspect of, we don't see it all. There is a really kind of siloed experience within our food system. I think there are often, it's a funny thing working in food, isn't it? Because it's kind of, everyone has exposure to food, we're all eating 3 times a day. We kind of think we know how it works, we know what our experience is of food. But actually, I think there's a sort of complacency that comes with that, and an assumption that then is similar to other people's experiences, and actually it's vastly different, as actually other speakers have shown through all those graphs. Actually, that we are seeing that actually our experiences are all extremely different. Our exposure in terms of our ability to access different foods. So it's really important that we bring on other people who have completely different experiences within our food system and can speak to all those aspects. And I suppose within advertising particularly, we know there's been so much evidence that young people particularly and people from deprived areas are targeted when healthy food. And there's some amazing evidence from America which shows that people of colour are targeted when healthy food advertising. So particularly African American and Latinx communities are targeted by really unhealthy food advertising, and then kind of the next neighbourhood over, which isn't African American and Latinx, it'll be completely different. So it's really important that we get that exposure and we then feed that into policy. I think there's a couple of important things that we are trying to do to address that. One is actually bringing that in within each of our policies, like for example, young people advocating and working with us. And then there's also the sort of longer term piece that Emilia spoke to as well, which is actually how we can improve food policy practitioners and the kind of sector so that it is more diverse, it's more inclusive, and there is more equality. And we have so much work to do on this. This is something that Sustain is really trying to, the organisation I work for, is really trying to do some work on. We've actually been taking on a big project to look at how we can increase diversity across the sector. I think that starts, kind of right from education, right through to job opportunities and making sure that we make the whole system so much easier to get into for everyone, so that we can make sure we're all better represented when we come to actually making and designing policies. So yeah, a lot of work to do. We're definitely not perfect right now, but I think there's been so much work across, since sort of Black Lives Matter and beyond, that has meant that we are now really trying to think about how we bring this in, and this is something which is being designed from the beginning in policies.
Thank you. Thank you all. I'll go back to online now for another question, and this is for you, Emilia, but others, please do feel free to participate. You mentioned lots of different opportunities for shaping healthier environments from the research. Is there one area that you feel we should start with?
That's a really good question, isn't it? They're always the hardest questions to ask. We always talk about obesity being complex, and both Sinead and I use the Foresight map with all the different factors, and that's what makes obesity and shaping environments so challenging, is that there are so many factors. I suppose today we've focused on the environmental level, so I would say it needs to be something that is around the environment and not the other scale in terms of the individual. So thinking about the environment, thinking about something that affects as many people as possible, and thinking about it in terms of equity. There's so many places where we have made some progress, but there's so much more to go in terms of food advertising, in terms of healthy planning. We know there are pockets of good practice in terms of rules around retail. So, yeah, I can't, you're asking me to pick a favourite child almost. I can't. So I'm interested in what everyone else thinks. There you go, Sinead.
Well, thanks for summing that up and handing it over. I mean, I think there's evidence of some policy areas that we could implement and have an effect right now. And I think, the farm to fork strategy at an EU level outlines the intention to bring in nutrient profiles to restrict the use of nutrition and health claims on food labels, to bring in mandatory front pack nutrition labelling, so there's an array of policies that are really ready to go, and I think for me they would be the ones to start with. Yes. And while also continuing to have some of these policies lined up as the next ones, because the evidence base is so strong for the nutrient profiles, the front pack labelling, and we're struggling to have that fully adopted.
And progressed, yes.
Yeah.
You were going to come in, Heather.
Yeah, so I was going to say, I think a big issue as well is the fact that a lot of the things that we discussed today, particularly I guess more so in the UK context, is that there's a lack of national will. It's pushed on, I think, to local government and individuals, and it's very much then, there's the champions, and that's why we have the good practices. There's some people who are doing amazing things, but if there's not that national and kind of EU level will, and then we're just going to end up with kind of greater inequalities.
Thank you. Thank you. I have a question for you, actually, Heather, from our online participants. You mentioned that planning policy tends to focus on restriction of hot food takeaways. Is there research, the best policy? Is there research on the best policy options to support healthier environments, adding healthier options in, rather than just restricting?
So I guess part of the reason why is that there's not evidence. And I think, so Amelia's been doing some stuff with the making takeaways healthier, but I guess the same sort of thing is it would be very difficult to implement. And the nice thing about the planning is that since we have these clear kind of building uses, it's much easier to do it.
Thank you. Are there any other questions from I have 2 questions from the audience, so we'll go back to our colleagues here in the room.
Thank you. I realised I didn't introduce myself the last time. Janice Morrissey, Irish Heart Foundation. This question is for Fran. I'm just interested in your experience working with the councillors, and you mentioned about the intense lobbying in terms of getting things through. What do you think is the councillors' kind of awareness of the kind of strategies employed by kind of corporate entities to influence policy making, and that kind of literacy around commercial determinants of health being such an issue in policy implementation? Thank you.
That's a really good question. I think there is definitely a need for increased literacy around commercial determinants across the board. I think we vastly underestimate the power and resource behind a lot of these companies and the influence, and that sense that often this is sort of something that happens in Hollywood films. It's not something that happens at even kind of London level, but also particularly places that are much smaller than London. I think there is a real problem in terms of conflict of interests and disclosure of interests. I think it's really important that we are looking as much as possible to kind of tighten up those public health processes and policies for actually agreeing, processes for agreeing policies, because we know that they are very vulnerable, even where they're very much proven policies, well evidenced. The TfL, or the Healthy Food Advertising Policy, which is brought in across London, that's coming up for 5 years. So we've had, in February, 5 years of that policy. So we've had years of this really great, fantastically successful policy, and yet we are seeing so much pushback at a local, and obviously, as other colleagues have said, at a national level in the UK as well. I suppose I couldn't speak to specific, I suppose different areas will have different awareness, and there's obviously always really very different politics at local level in particular areas, depending on what the specific interests are. But my finding in general is that many local areas vastly underestimate how much influence there is by these companies, and I think we need to look at how we can really protect these policies effectively. I'm not sure that, I think we have to think about how to do this as strategically as possible. So it's not always involving councillors. Usually it's kind of going up through the public health and then the staff routes. Obviously I have to look at kind of what that means in Northern Ireland and Ireland context. But in general I can say that there's a lot of work to do.
Thank you. And we have time for our final question. Yes, you need a mic on you. Just a second.
Yeah, so it's more so maybe even a bit of advice or a suggestion for us. Myself, Joanna and Georgia are running a food club, so like a food pantry, kind of social supermarket. as a pilot project. It's going really well we work in like the deprived areas in Dublin, so we're trying to get access to fresh foods at like a low cost, and we're doing it maybe as like a bridging the gap of it was people that were receiving food parcels, so the next step is the food club. But we're seeing is people's situations are changing and their access to nutritious food aren't there, so there is a real need in these areas to have like food hubs that supply surplus food with the sustainability of the food waste. But there needs to be more hands on deck, if you know what I mean, because like even us running it, it's quite hard to do. So I suppose for these areas, would there be suggestions what you think could be done in these hubs to support, I suppose, access to nutritious food and that whole sustainability side of things?
It's massive. It's a massive issue, and I guess your experience in that area in Dublin will be seen not just across Ireland, but across the UK, Europe, and the rest of the world. And it's a massive challenge. It's skill sets that we don't have around logistics, food pallets, food safety, labelling. I think my advice would be look at a number of different models, because there are so many different models. For example, if people are getting in things like catering size mayonnaise, how do you stop that from going to food waste because you don't have the necessary food hygiene to bottle it up? So there are organisations like the Bread and Butter Project running in the UK, which has got a very interesting model, and I think it's kind of a source of frustration that we have to have these models, that we don't have equity and access to food, but that we now have a different food system. And I suppose kind of coming back full circle, it's about that community involvement and that community ownership and that destigmatising of it. So seeing it similar to how they've done in Middlesbrough, again another model, an eco-shop model, that this is about reducing food waste but at the same time providing accessible, affordable, healthy food. Yeah, but there is so much we can pick up, and I can give you some details of other models to look at. Yeah.
Thank you, Amelia. Thanks to all our speakers for a fantastic Q&A session. Very interesting. In the interest of time, we'll have to move on to the closing remarks. I do acknowledge that there were some questions online that we didn't have time to get to. We will ask our speakers to provide answers, and we will be emailing them with other resources that we are emailing after the conference. I am delighted now to introduce Professor Mary Brennan from the University of Edinburgh. Mary is the Dean of Education at the College of Arts, Humanities and Social Sciences, and the Chair of Food Marketing and Society, University of Edinburgh Business School. You're very welcome. Thank you.
Thank you very much. Oh, wow. What a morning. My infamous mind maps are out. They can be bought if required. It's my absolute pleasure to be here to try and bring things together, but also give a little bit of a flavour of how Scotland is attempting to address some of the issues and the challenges that have been raised. So I will first of all sort of sum up or think about what has really stuck out for me, and then sort of give maybe some hope and some interest in terms of the way in which that national paralysis or that lack of national will can be addressed, can be challenged, can potentially be reimagined, and what we're trying to do in Scotland. And coming back to the one thing that sort of caught me there when I was talking about the national will is also what I've experienced certainly in Scotland and more broadly is that sense of how national government, not specifically Scotland, but national government can be sabotaging what local government are trying to do, or the really inspiring efforts that are happening in communities and in local government. And that is underpinned, certainly in the UK, by a public funding crisis in local governments. And we have local governments that are bankrupt, some of them being some of the largest local authorities in the country. And I think that sense of sabotage and that sense of not really the conflicts of interest, the challenges that are playing out there. We have a new Minister of Health who is married to the Chief Executive of British Sugar, so she is actually in his bed, we presume. And I think while we might laugh about it, it's a very interesting sort of state of affairs that we find ourselves in, and there's real tensions, and there's real differences, and there's real different political will between the regions of the UK, including Northern Ireland. One of the things that has really stood out for me is this idea of how the odds are stacked against any of us, whether that is individuals, households, communities, even those businesses that are trying to sort of promote or deliver, those organisations that are trying to promote and deliver, and how actually we have a social imperative and a responsibility to unstack those odds. And the older I get and the less I care about what I say and the more HRT that's involved, the more you get to the point where you're saying mandatory change is essential here. We have to reconsider the social contract that allows the businesses and organisations that are central to our food system and integral to our food system, and I am a champion of many of those, is what is the social contract and the social responsibility they have to the health of our nations. It's as simple as that. And I think Sinead's work beautifully highlights that in terms of, what leeway, what flexibility, what rights do these supermarkets who hold such power, who hold such control, have over what they sell and the distribution and the balance between how they are using their spaces and their power and their presence within our communities. And I think, in that, I'm not saying I have a magic bullet, but I think you do look at what is the maximum percentage, what is the distribution between the high fat and sugar, and then coming back to what Fran was talking about, you don't ban them from selling these products, but you say there are restrictions on how you can sell them. And I think the other thing that has become really strongly outed today is how important it is for us as researchers and as policymakers and as advocating organisations to challenge the economic narrative and to reframe the way in which public money is going into solving and curing the consequences of poor health or poor dietary behaviour. And not going into preventing it and sort of reframing. I do a lot of work around public food, and again, how we are having to think about reframing what we spend on school food as an investment in our young people, in their education, in their health, in their communities, rather than as a budget line cost, which is essentially what the sort of Treasury orthodoxy sees them as. I think another thing that has really stuck out, and this is something that I battle with on a daily basis through the organisation, the Scottish Food Coalition that I chair, which is an organisation of third sector organisations who are advocating for food systems transformation in Scotland, is this really tense and at times difficult and at times ethically complex relationship between obesity and food insecurity and poverty. And the relationship to the endemic social inequalities that have certainly played out in the UK in the 25 years I've been living there, but which are not absent in Ireland. They may be somewhat different on the island of Ireland, they may be somewhat differently distributed, but they are not absent. And I think we have to, and that's where that hyper-local
becomes really important about what works for different communities, what works for different households. How do we support and enable and empower them to have a better relationship, a more stable relationship, a less antagonistic relationship, and a healthier relationship with food, given everything else that they are dealing with. I have huge admiration for Sinead and the work that she did in those supermarkets. I did different but similar in scraping plates, nearly 21,000 of them, in schools across in Scotland, where we were collecting food waste, separating that food waste. Sometimes you got to roll your sleeves up and you got to get dirty, and I'm sure you got dirty measuring. And in order for us to challenge, because we don't have that, there is data. I suspect, I'm on your side, I think they probably do know. And they certainly know what they're selling, and the relationship to that. I mean, of course, it's not just floor, it's up and down, isn't it? It's all over, it's that total amount of space. But that data isn't available. They're not going to make that data available unless it's mandated that they make that data available. Now, there are challenges around the mandation, which comes back to the incredible work that environmental health officers do, but it is almost collapsing, certainly in the UK, the environmental health system. And therefore, we have to think, how do we manage the process of mandatory regulation? And I say regulation almost more than policy. I think it needs to go into the legislative sort of realm, with the actual burden then of monitoring and reporting and scrutinising. So I think there's some really interesting dilemmas there. I think we do, it's come out a number of ways that we have choices to make. Some of them are incredibly difficult. Some of them are less than ideal. But there are choices that we need to make to leverage and to develop policies and legislation that gives us the biggest bang for our buck. And is transformative in its power and in the number of people that it influences. And I think what Fran talked about there, and you see it when you're you now are being advertised lots of very nice things in Transport for London that isn't high fat, sugary foods, but is usually lots of other nice things. But it is very, very visceral when you're in that environment, how different it is. And that is similar to how many of us experienced the ban on smoking in public places. You know, it has viscerally changed the way in which we experience these environments and behave in those environments, and also what we thought was acceptable socially and in other ways. Going back to my economic narrative, I think one of the tensions I've certainly seen play out across Scottish local authorities, of which we have 32, you can get them into a room, it's not impossible, is the tension between economic drivers, economic outcomes, and the desire to develop their regions, develop their market towns, revitalise with the challenges around balancing sustainability and healthy eating goals. And I think there's real tensions there, especially in local authorities. I'm thinking of Inverclyde in particular. Inverclyde is a west coast on the Clyde, not far from Belfast, and it's very deprived. And as a result, the local authority is in somewhat of a bind, because it just doesn't have the money. It's not able to generate the money. And so its revenues are much less than other local authorities that have more options, more flexibility, more economic vitality within them. So I think some local authorities are in really tight grips about what levers and what options they have for income generation and therefore income redistribution. Going back to, and I'm fascinated as when Amelia was talking about the sort of new frontiers and the way in which COVID, and I think in particular, this is impacting our Generation Zs, of which I'm sure there are some in here. There are no Generation Alphas
in here yet, but don't worry, they're on the way. Some of you have Generation Alphas at home. They're about 10 or 11, so they were born after 2012. But their understanding of food provisioning and where they get food from and their relationship to cooking, their relationship to shopping is dramatically changing. In terms of they are outsourcing that. That's what delivery services are for. So young 20s are not cooking at all in some cases. They are totally using these services, both in terms of being time poor and just not being interested or wanting the variety that those delivery services offer without the need and the effort to have the capacity to deliver that variety. So I think you are looking at real generational shifts that are going to impact the broader environment, as you were talking about, whether it's online delivery. I was also thinking about street food, okay, and the relationship that street food plays in terms of these issues. Drones, interestingly, Argyll and Bute Local Authority, one of the largest and more complex in Scotland, is using drones to deliver school food to some of its remote islands. They were using them to deliver vaccines during COVID, so there's some trials going on. Drones can be good, but they may also have other areas. And I think the point that Fran made, and I'll sort of pull that together in terms of where we are in Scotland, I think that sense of local authorities and/or mayors, and the mayors are developing a really strong voice for their regions and communities, voices that are not necessarily as politically consistent to their parties as they would need to be in other contexts, is about them understanding what they can and can't do, where they have power and influence, what sort of rebalancing of the dynamics of power and control within the system they are able to interact with. So we are beginning to see in Scotland a movement through a decade-long campaign for new legislation called the Good Food Nation Act, which was approved in became law in July 2022, and is requiring both national government and relevant authorities, that's the local authorities, the 32 of them, and the 14 health boards, to produce local Good Food Nation plans. So we will have a national Good Food Nation plan and a local Good Food Nation plan. Now, plans are great, but they also have to be actioned, and they will also be monitored and reported on and have to be evolved and developed. And that's where the citizen engagement becomes really important, and the wider advocacy is that they are able to, they have to consult publicly on those local plans. They have to engage their local communities. They have flexibility of how to deliver against the agreed outcomes for their local areas, but there is a commitment that they will all deliver to the agreed set of outcomes, which are systems level and cover social, economic, health, and I've forgotten one. I've forgotten them. It's a lot. It's gone too far. So one of the hopes that we have, and this is maybe a long term, it's not going to happen in the first iteration, is that this provides local authorities with the both the carrot and the stick, and the monitoring that will be delivered through a new Scottish Food Coalition, a statutory commission, similar but different to what is being talked about there about the Food Board in London, that will monitor and report and advise and impact actually the broader community of practice for food systems transformation in Scotland. And I will end on the point that where that issue around the professionalisation and the skills and the development of policymakers, of advocacies, of researchers who are capable of thinking systemically, who are capable of working in transdisciplinary groups. It's no longer sufficient to work multi or interdisciplinary. Our careers have got us the whole way through, haven't they? We were really special 20 years ago, but there's new ways of working, new ways of thinking. Your ego and new evidence new data that you have to be able to cope with. And I think that's at the centre of driving and understanding what are those key policy initiatives or legislative changes and levers that we can choose. Are we confident in understanding about the trade-offs, the costs and benefits of these different things, and how then we bring the will and the courage and the legislative context behind us to say we have got to do things differently and we have got to change the way in which business, the public and broader society connects and interacts with each other in terms of our diets and our broader relationship with food. Thank you. Not sure if I could
Thank you, Mary, for your words, for your enthusiasm, and we may take some pictures of those maps and email them with the recordings, if that's okay.
They are beautiful. I feel like I'm now officially the fourth member of Westlife, but I'm too small for the chairs.
This brings our event to a close. As I mentioned, presentations will be available, and so will be the recording of the meeting. For those of you online, once the meeting is over, you will see an online survey. We would love to have your feedback. If you require a certificate of attendance, please do drop your email into the form so we can forward those on to you.